Hello and welcome to the Valley. Today I am your host, Janet Michael. It is Community Health Day. That is the day every month that we jump on a Zoom with someone from Valley Health. They, of course, sponsor this program. We've talked to cardiologists and neurologists. We've talked to administrators, social workers, nurses, mental health professionals, all of the peoples. And if you want to find all of those conversations in one place, you can go to thevalleytodaypodcast.com, click on categories, and VH Community Health is there, and you can get all of your medical advice, although they probably frown upon me saying it that way, in one spot. I am pretty happy to welcome back Dr. Jim VanKirk to the show today. He is a board-certified palliative care specialist. He is also the medical director of Valley Health's palliative care program. Joining him is Rachel Schwartz. She is a social worker within that program. We're going to talk a little bit about why that is important today. But Dr. VanKirk, thank you for agreeing to come back and do the show yet again. I always love it when a guest agrees to come back more than once because it means I haven't completely freaked them out.
Thank you, Janet. We're happy to be here.
Let's start with the basics. For someone who is listening that hasn't heard any of our previous conversations, and I say the term palliative care, what does that mean exactly?
Palliative care is a specialty in medicine where we work with people who have life-threatening illness and try to smooth the path, try to provide additional support in symptom control, in helping to plan for what may come next. How do they want to navigate their treatment course with the many different options available? So many people hear the word palliative and immediately think that this means end of life. They equate hospice the same way. It must mean that you're going to die in the next 3 days. And we do our best work with people way before that, many times while they're still receiving aggressive treatment. So we work with a lot of patients in our intensive care unit here at the hospital. We work with a lot of patients who are still receiving chemotherapy or radiation therapy for cancers. And so we really want to be able to support people earlier on in the course of their illness. And some really good studies show that people that have that intervention and that support earlier in their illness actually do better and live longer.
That's a very important point to make because I agree with you. I think a lot of people hear palliative and they think terminal. And while that is often the case, I have learned in just the last 10 years of doing this show with Valley Health people that technology and medical advances have come so far and happened so fast that you could be terminal at the beginning of the year and have some sort of trial medication or a robot surgery that suddenly is available to you that does extend your life. And having that good care in between is incredibly vital.
Right. It can make all the difference. At the same time, what I always say when I work with physicians, one of my jobs is also to help teach physicians. We have a lot that we can do, and we are all trained to think that way. Here's the diagnosis, here's what we can do. The challenge and what our program tries to bring is what should we do? And that means really spending time with the patient and the family for what are your goals? What are you willing to put up with? Maybe to buy some more time. What kind of risk are you willing to take? Because certainly some of these aggressive treatments can be fantastic, and sometimes things don't go as well as we'd like them to, and then it may be a problem. And that all is dependent on the patient's baseline health status and age and what their condition is going into the treatment. So those are all things that we try to help people work through. And those can be tough conversations because they're really challenging to make those decisions.
And Rachel, it's not always just about a medical decision. Sometimes, a lot of times, I suspect families play a role in that. What does mom want for her child who maybe is suffering from cancer? I'll use, or the child for their parents. And I think mom would want to do this, or I think dad would rather go this way. And everybody has their own opinions and their own outlook. Having to manage that dynamic has got to be difficult.
That's a very good point. I think On our palliative team, a lot of time when we say we have a patient, the patient often includes the family or whoever is important in that person's circle. They're all going through this difficult time. So we try and support them all, acknowledge what they're dealing with, at the same time, really trying to bring it back to the patient. If the person can't speak for themselves, we try and encourage the other parties to be able to identify what would your mom want if she could be better health and look at the situation as it is right now. What do you think she would say? What kind of guidance would she make? We call that substituted judgment, and we really encourage folks to act on the values and wishes of the person going through the illness directly.
I think grief plays such a large role in a lot of these cases as well, because you hear whatever a diagnosis may be. And while you know that there could be potential treatments and things that maybe are positive, immediately you're thinking, oh my goodness, I'm going to lose this loved one. And then grief colors maybe your decision making process or how you react to different information when it's given to you. So having a social worker involved in this entire situation has got to be beneficial.
Thank you. I'm so thankful that Valley Health is committed to having a full-time social worker on this team because it really is a specialty that requires different disciplines. And while we don't have other disciplines on our team, we do work very closely with some of the other disciplines in the hospital. We work very closely with chaplains, music therapists. We often get referrals from our speech therapists, the nurses at the bedside. The more closely we can all work together, the better it is for the patient.
Dr. VanKirk, I hear that a lot when I talk to other physicians in other areas of expertise throughout Valley Health, is that rarely is it one doctor, one patient, and that's the entire circle. That there are teams of people that work on all sorts of illnesses. But I would imagine in your field in particular, that is a pretty large team that you really do pull in different people, maybe that others wouldn't necessarily think to include.
Yeah, well, this is a team sport. There's no question about it. And I really think hospice was the first group that modeled total team care. And the rest of us now are trying to catch up with them. But all the different groups that Rachel talked about, all the therapy services, bringing in physical and occupational therapy, it is a team of providers that are trying to work with a team of people. It's not just the patient or just the patient's illness. You really have to take off the blinders and broaden your view as much as possible. Because as you both have said, families involved here, grief is a huge problem that we have to deal with. And we run into people all the time who are still suffering from unresolved or complicated grief from the loss of a loved one years ago. And so it's not just something that happens for a short period of time. This is something that can affect the person's life for the rest of their life.
And it rarely is just one of those people, because people react to grief in so many different ways. If you have a parent that has multiple children or has grandchildren that are very active in their grandparents' lives, one may react one way and another may react another way. And trying to keep everybody on the same page and, to Rachel's point, focused back on the patient can get difficult, I would imagine.
And I just wanted to add with the grief, certainly grief around a death can be very traumatic. But what I think we try to do in palliative care as well is dealing with the grief that occurs along the way of a progressive illness. Because as we are living longer with these illnesses, people do lose a lot of things along the way. Whether we have a loved one with dementia and we're slowly losing that person that we knew, or somebody with a devastating illness who's losing a loss of their own function and feeling a loss of their own purpose. We really try and keep the conversation going about being open about that and what matters to them as life changes along the way. So there's grief all throughout.
Dr. VanKirk, we've had a lot of conversations in the past about advanced directives. Healthcare Decisions Day was April 16th, and I know we've done shows around that date before, but these are decisions that can be made and should be made any day of the year. Can we take a break and come back and talk a little bit about the role that having made those decisions before they're necessary plays in that grief process that we're talking about?
Absolutely. It's so critically important. A great topic.
We're going to do all of that when we come back. We are on the Zooms today with Dr. Jim VanKirk. He is a board certified palliative care specialist, as well as the medical director for Valley Health's palliative care program. Rachel Schwartz is joining him. She is a social worker on his palliative care team. We're going to talk a little bit about making those choices before they're necessary and the value and benefit in doing that when we come back in just a couple of minutes.
Wherever there's a need in our communities, there's a United Way. Improving lives so everyone can thrive. Where more people can gain access to healthcare and nutritious food for their tables. Where more community members can benefit from financial education and get connected to local resources for housing support. And where children are given more chances to reach their full potential. Community is where we find our strength and where we share our hope. United is the way. Visit unitedway.org.
Welcome back to the Valley. Today, I am your host, Janet Michael. It is Community Health Day, sponsored every month by Valley Health. Today, we are on the Zooms with Dr. Jim VanKirk. He is a board-certified palliative care specialist and the medical director for Valley Health's palliative care program. Rachel Schwartz is joining him. She is a social worker on his palliative care team. And Dr. VanKirk, when we went to break, we were talking a little bit about advanced directives and Healthcare Decisions Day having happened on April 16th. So when I say advanced directives, what does that mean? What does that include exactly?
So an advance directive is a document which expresses a person's wishes for their health care, particularly if they get in a situation where they're not able to speak for themselves. And usually the first part is where they identify somebody to be their healthcare agent, somebody to be a decision maker for them. And then the second part sometimes is also referred to as the living will, and it may have specific wishes about if I am in this kind of situation, do or do not do these things. But really, an advance directive is any document that expresses these wishes. Each state has its own little variation on this, so it's important to know what state you live in. The West Virginia Advance Directive, to become a legal document, has to be notarized as well as witnessed by two people. In Virginia, we don't require the notary. So important to know where you live, but they're great at helping guide your care. The important thing that we always emphasize is that the importance isn't the document. The importance is the conversation that leads to the document. Because the person that you choose to be your decision maker needs to know how you think and what's important to you and what you would or would not want. And so that's where it's so critically important that people have these conversations with the people that they choose to be their decision maker.
When we've had this conversation in the past, a few of the things that you and I have talked about is the fact that whoever you choose that person to be, you should tell them first and foremost.
Yeah.
Don't let them find out in a different type of way. So make sure they know that you are who this person is and this is why I've chosen you. And you also need to let other friends and family know that this document exists so that they are aware that decisions have already been made, because sometimes that can cause some confusion in the heat of the moment. For example, we talked earlier about a long-term illness, but it could be a car accident. It could be any number of things that you can't necessarily plan for, that these documents are really valuable to have in that moment.
I'm glad you brought up the whole car accident thing. Many people think that's not a document I need to worry about until I'm 60 or I'm 80 or I have a diagnosis of something. In my household, a kid fills out their medical advance directive on their 18th birthday.
I remember that.
Adults should have one of these. I don't want my children to ever be unconscious in the ER from a car accident. But if they are, I want it to be very clear who's calling the shots medically. And so every adult should at least appoint a medical agent. You also raised the bit about family struggle. We see families all the time, and my own family went through this. My family with multiple healthcare professionals, when our parents were ill and approaching end of life, there was all kinds of conflict about, I think they should do this, I think they should do that. And that was actually the trigger that led my parents to completing their own advance directives. It should never have waited that long. Families can be blown apart by the struggle that happens with an acute illness. And when these directives are done ahead of time and everybody knows about it, it means that if they need to be pulled, if they need to be called upon, there's going to be so much less stress. And it doesn't even have to be a family member. Some people want to choose their best friend, and that's okay. But like you said, make sure your family knows.
I remember you telling me that this was something that you celebrate on your children's 18th birthday. I also recall a story where you reminded everyone that they also need to update them. This is not a permanent do it once, set it and forget it, because you had forgotten to update yours, if I recall correctly. So people need to stay on top of those things as they progress through life.
Right. You've already mentioned it. April 16th is Healthcare Decisions Day. This can be done any day of the year, but here's the easy way to remember. April 15th is tax day. That's when we all take care of our government. That means April 16th, the day after, is the day that we take care of ourselves. And so every April 16th should be a reminder to review your own personal documents. And this one is one of the very important ones. Wills, power of attorneys, healthcare advance directives. And you're right, my dad was my backup agent and I missed it. 2 years after he died, I realized that I still had him on my advance directive as my backup agent. Obviously, he wasn't going to be able to help me at all. So very important to just review and make sure that they're kept current.
Rachel, we were talking earlier about the various stages of grief that a family sometimes goes through. And I would imagine that those look very different. If you have a situation where those decisions have been made, the person that is in the hospital bed has made clear, this is what I want to have happen, versus the family or the loved ones that are surrounding them that are now navigating making those decisions. It's probably a much easier process.
I think that's an excellent point. Yes, for a family member who doesn't know what their loved one would want, they feel this great burden of responsibility, understandably, that maybe they're pulling the plug or pulling it too soon. And when it's something's been written down, we really let them know that the loved one's not making the decision, they're honoring the decision of the patient. That can be such a gift when it's done like that, when it's clear in terms of how they cope after the person dies.
Do you help patients with that? So let's say there's a scenario where someone is diagnosed with some sort of cancer that is going to maybe be 6 months, a year, 2 years as they go through their different treatments and things like that. Do you get involved early on in the process to work with a patient to ask, do they have these? Do you need some help filling them out? And then start that conversation with the family. One of the things Dr. VanKirk and I have talked about is how hard it is to sit down with family and say, I want to talk about when I die. Having a professional in the room, I would assume, makes it maybe a little easier.
On our palliative service, we bring these up multiple times a day in our work. It's one of several important interventions, but this is something that all of our team members can do regardless of the discipline. And we try and destigmatize it as much as we can. It's not just about how do you want things to go when you die. It's really about how do you want to be cared for if there's a time you are quite sick and can't speak for yourself. You may improve. That's wonderful, but it's really just for those, it's only activated if someone's not able to speak for themselves. So we encourage it as a protection for those times so their wishes can be honored and that we as a care team know that we're talking to who they trust.
So I have a son who's 30. I would not want to lay that responsibility on him. So as a parent, I feel like it is my responsibility, as it was to make sure he was fed and went to school and did all of the things to make him a productive human being in society. It is also my responsibility to not make him have to make those types of decisions as a parent. I am quite a control freak. So I like the advanced directives because it means I'm still in control of everything, even if I can't still be in control of everything. So for those personality types out there, this is for you.
Good point.
Is there a place on the Valley Health website, if somebody's listening today and they're realizing this is something I have been putting off and I need to make some decisions? Rachel, is there a place where people can go and at least learn a little bit more about what they are and how they work?
Yes, more information on advanced directives can be found on our Valley Health website, valleyhealthlink.com. Click on Your Visit and Patient Resources from the main page. And it has answers to frequently asked questions. It has links to different forms for different states or national forms. And if you want to schedule an appointment with a facilitator, there's a number on there as well. So it's a nice collection of lots of good information.
Dr. VanKirk, it's also important that whatever those directives are, that they are also attached to your patient records at the hospital. So if I am in a car accident in Arizona, they would be able to pull my records and see what those are, even if I weren't in my home hospital.
Your primary care physician should have a copy. The hospital should have a copy. They'll put it in the computerized medical record. There are some states, West Virginia is one, that have state registries where people can have them placed there. So yeah, this is not a document where you complete it and you put it in your lockbox. It needs to be out there. Your agent, the person that is going to be your voice, should have either a copy or the original. They're the ones that you're going to want to be there with that document in hand, backing you up. So many of us, and we talked about this at the beginning, so many of us equate these conversations and all of this with death and end of life. And I think Rachel alluded to this before. We really want this to be an emphasis on how are you going to live until you die? How do you want to live? What's important to your existence until that time comes? So it's really about living.
I have a friend who is an attorney, and she frequently talks about the number of people that call her when their parents, for example, have been diagnosed with Alzheimer's or some form of dementia. And the problem is that they call her too late in the process to get that power of attorney to do those things because the illness has progressed to the point where they are not capable of signing those documents. This is another scenario where the sooner the better, because you just don't know, even from an illness perspective, what might change.
Exactly.
Dr. VanKirk, thank you for taking the time to remind me of all of this. And I hope now you somewhat see a flood, I guess, of advanced directives coming into the hospital.
There you go. Thank you, Janet. It's always a pleasure to talk with you. We really appreciate all the assistance getting this information out to folks.
And Rachel, it was great to meet you, and I hope I never have to meet you again.
Thank you for having me.
I will be back tomorrow with a brand new episode of The Valley Today, just a few minutes after noon, so meet me here then.